The year 2026 marked a significant shift in U.S. dietary policy with the release of updated guidelines, spearheaded by U.S. Health and Human Services Secretary Robert F. Kennedy Jr. These new guidelines introduced an inverted food pyramid, aiming to reset federal nutrition policy by prioritizing protein and healthy fats while minimizing processed foods and added sugars. The core recommendations emphasize whole, minimally processed foods, advocating for a reduction in refined carbohydrates and a declared war on added sugars. Kennedy highlighted the importance of eating real food, stating that processed foods with additives, added sugar, and excess salt are detrimental to health. The inverted food pyramid places protein, dairy, and healthy fats at the top, alongside vegetables and fruits, with whole grains forming the bottom. This new visual framework contrasts sharply with previous models that traditionally emphasized grains as the foundational element of a healthy diet. The guidelines increased the recommended daily protein intake, advising adults to consume 1.2 to 1.6 grams of protein per kilogram of body weight. They suggest incorporating a protein-rich food into every meal, with acceptable sources including meat, eggs, poultry, dairy, seafood, and plant-based options like beans, nuts, and soy. Regarding fats, the guidelines prioritize oils with essential fatty acids, such as olive oil, and include options like butter or beef tallow, aligning with Kennedy's views against seed oils. The guidelines also highlight the importance of consuming full-fat dairy, recommending 3 servings per day as part of a 2,000-calorie diet. A major focus of the new guidelines is the avoidance of highly processed foods, with Kennedy declaring war on added sugar. Processed foods loaded with additives, added sugar, and excess salt are deemed harmful, with recommendations to limit added sugars to no more than 10 grams per meal, or about 2 teaspoons. The U.S. dietary guidelines have a rich history, with the first guidelines introduced in 1980 and updated every 5 years since 1985. This process involves collaboration between the USDA and HHS, with input from a Dietary Guidelines Advisory Committee comprising nutrition and medical experts. These guidelines serve as the foundation for federal nutrition programs, influence school lunches, and shape medical advice across the nation. Early nutrition guidance dates back to 1894, when Drive Wilbur Olin Atwater published the first guidelines, focusing on food groups and safety. During World War II, the USDA introduced the basic 7 food groups to maintain nutritional standards amidst wartime rationing. In 1977, the Senate Select Committee on Nutrition and Human Needs, led by Senator George McGovern, released dietary goals for the United States. These goals recommended consuming only as much energy as expended, increasing complex carbohydrates, and reducing fat and cholesterol intake. The 1980 dietary guidelines generated considerable controversy, leading to the establishment of an advisory committee to revise future editions. The 1990 guidelines further emphasized balancing food intake with physical activity, a concept that continues to be relevant today. However, the 2026 guidelines and the inverted food pyramid have faced criticism from some nutrition experts. Concerns include the prioritization of red meat and full-fat dairy, citing potential cardiovascular risks and contradicting decades of nutrition research. Others worry about the lack of clarity and potential contradictions within the guidelines, particularly regarding whole grains and essential fatty acids. The new guidelines reflect elements of Kennedy's Make America Healthy Again agenda, which aims to overhaul the U.S. food supply and combat chronic diseases. Kennedy has been a vocal advocate for reforms to the food industry, targeting ultra-processed foods, added sugars, and harmful additives. The Maha Commission's report called for putting whole foods at the center of healthcare, boosting nutrition research, and minimizing food industry influence. The 2026 dietary guidelines are expected to have a significant impact on federal nutrition programs, school lunches, and public health initiatives. Kennedy's focus on food as medicine could lead to greater funding and research into nutrition for preventing and treating disease. The guidelines may also influence consumer demand for healthier foods and prompt food companies to prioritize health in their product development. As these new guidelines take root, how will they ultimately reshape our understanding of a healthy diet and the future of nutrition advice in the United States?